there, my name is Richard. I am a student nurse. Can I get your name and date of birth?
Yeah, Miss Arthur, July 20th, 1962.
Great. Okay, Miss Arthur, I'm going to give you some privacy. I'll wash my hands. So, Miss Arthur, I am here just to give you some general information about your new prescription and just some things that you should be mindful of as you continue with the drug therapy.
Okay.
So before we continue, I've noticed that you were admitted because you had a lot of pain in your right leg and your hands because you have arthritis, rheumatoid arthritis, and atrial fibrillation. Are you in any pain as of right now? With 0 on a scale of like 0 through 10, 0 being no pain at all and 10 being the worst? 4. Great. The reason I ask is because having pain can inhibit learning, and we don't want that because we're going to teach you about a new medication. And you're not in a lot of pain, so we can progress. Although, are there any cultural considerations, any background information that you would like me to address and consider into the nursing plan? Great. Let's continue. So, let's begin with the medication. So you were prescribed heparin. Heparin is basically a anticoagulant. It works on your blood. So your blood has these proteins that it needs to make blood clots. And what it does, it stops it from converting. It stops their conversions. So the key won't be in fibrinogen being converted to fibrin. Or fibrin converted to fibrinogen. So it inhibits this conversion. And fibrin is vital for the blood to form clots. And without it, it can't. And some of the things that I forgot to mention is that heparin, which is its generic name, also has a brand name of heparin Leo. And let me just double check my notes to make sure we're in the right direction. Okay, now I'm gonna briefly talk about adverse effects that you should monitor. So the biggest one being risk of bleeding. So you need to make sure you're not participating in any activities that you can get injured in, because you can bruise internally or bleed internally.
Okay.
And you need to monitor signs of internal bleeding, such as, or just bleeding in general, such as bleeding gums, bloody nose, severe headaches, GI distress, such as ab pain or dark tarred stools, and making sure you monitor for ground emesis, like throwing up, coffee ground-like substance, that's indicator of internal bleeding. And another one being the little purple dots that just come out of nowhere. That's, I don't remember specifically the name of it, but I will go and do some more research and bring you back the name once we're done. And some interactions you should be mindful of are salicylates, which you are prescribed aspirin. And we need to avoid aspirin if possible because it increases your chances of bleeding. And we want to limit that. The next one being high potassium foods. So we need to be mindful of the foods that we are consuming that are high in potassium, as they can decrease the effects of heparin. So I actually made you a list regarding like high potassium foods such as green leafy veggies, cabbage, soybean, and broccoli. These are just some things you can have with you, just quick, easy access.
Oh, thank you.
Just so you're aware of. Okay, and just you can take with you. And let me backtrack a little bit because there is one thing that I forgot to mention is the risk. It's an adverse effect, and it's the risk of thromboembolic events if you abruptly stop the medication. So it is crucial you do not stop it, and you have enough medication to last. Okay? Great. Now that we've covered over general information, let's kind of go towards administering the medication. So heparin was prescribed in 5,000 units, subcutaneous 3 times a day. So 1 ml, 1 milliliter is 1,000 units. So we will be using this red needle, which is a 22-inch. We'll be using this 25-inch with 5/8 needle and this 5 ml disposable syringe. So basically what we are gonna be doing are, I'm sorry, I'm getting ahead of myself. We're gonna open everything up, making sure we have easy access. Next, we're gonna get our alcohol, the disinfecting pad. We're gonna disinfect the top of the vial and our skin. We're gonna let it air dry. Now that it's air dried, we're gonna inspect the vial, making sure there's any abnormalities, none. Next, we're gonna get our syringe. We're gonna grab our needle, the red cap, 22. We're gonna take off the safety cap. Put that away so we don't poke ourselves. We're gonna withdraw 5 ml, making sure we're using the first black line. And we're gonna insert into the vial the needle and inject the air. We're gonna turn the needle and we're gonna make sure we withdraw 5 mLs, ensuring that there's no air bubbles, and which there isn't. Next, we're gonna make sure we don't touch the safety cap. Make sure we don't poke ourselves by just hovering over into the safety cap and then grabbing the bottom and then twisting it, making sure it's secured. We're gonna take it off. We're gonna grab our next needle, the 25-inch with the 5/8 gauge. We're gonna take off the safety cap and we're gonna take off the needle away. We're gonna press down on the safety cap, ensuring it's withdrawn. And then we're gonna come in at a 45-degree angle. Keep in mind this is your belly button, your umbilicus, and we need to be 2 inches away. So we're gonna pinch the skin and inject at 45-degree angle, inject all the medication. And then once it's done, we can let go, we engage the safety cap, and we can dispose of all of our sharps in sharps container.
Okay.
And if you don't have one at home can be basically anything hard plastic, such as like a detergent. So I would get rid of all these. And some key things is that you do not want to rub the site and make sure you alternate. Okay, next I would like you to show me.
So grab all of my equipment, and then so I'm going to cleans, insulin, heparin,
Correct.
and then the tissue.
Correct.
Make sure everything is good, and then let it air dry. I'm gonna open my stuff, making sure I have easy access for everything. And then I'm gonna use this needle with this syringe.
Correct. Which is your 22.
22.
Oh, 22 gauge.
Carefully
Dislodge.
And then we have to get 5 milliliters. Insert into this vial. Push down and make sure we get 5 milliliters. Okay. Then we're going to carefully put it back in. And then take it off. And now we're going to grab the other one. We're going to twist and lock. And take off the safety. Take off the cap. And then you said this has to go up.
Correct.
And then this is my belly button, so 2 inches away. I'm gonna pinch and at a 45-degree angle, I'm gonna come in and insert all the medication, and then pop it back in and just put it in the sharps container.
Correct. You would get all your equipment, all your sharps, and put them in the sharps container.
Oh yeah, I forgot that. And then do not rub it, and then I'm gonna switch sides.
Correct. Make sure you alternate sides
Okay.
to prevent any irritation. Great. So now that everything's been disposed of and teaching has occurred, do you have any thoughts, questions, or concerns you would like me to address?
No, I just have to no aspirin and no stopping my breath.
Yep. Correct. And be monitoring your foods.
My foods, yes.
Correct. Awesome. Thank you, Miss
Thank you.
Arthur. Teaching I would wash my hands. I have finished this project.
Thank you.